So, good morning, everybody. My name's Jenny, and I'm from Rosendale Valley Energy, which, for those of you who don't know, we're a community benefit society up in East Lancashire. And one of the projects that we're delivering on is the LEAD project. That's also tied in with our bigger net zero Terrace Street project that's working on a shared loop heating system with no upfront costs for the householder. So, okay, so yes, as I say, I'm the lead project manager. I've got a background with Citizens Advice previously, managing various projects for them, one of them being energy. Can you hear me? Sorry, I just realised my mic was up on top of my head. Sorry about
that. Loud and clear, Jenny.
Is that okay?
Thank you. Yeah, thank you.
So, for those of you who don't know, I'm assuming probably everybody here does, but just in case, the LEAD project, Local Energy Advice Demonstrator, is a DESNZ funded project. It's been funded for 2 years and is due to end in March next year. Up here at RVE, we're a small team on the LEAD project. There are 5 of us paid staff in total, and we have 2 volunteers. Combination of energy advisors and energy champions. And the LEAD project is a test and learn project from DESNZ, and what they wanted to look at was innovative ways of delivering energy advice in various advice settings, advice backgrounds. So I think there are 35 altogether nationally, I'm not quite sure, 30 something anyway, and I think we're all doing it a little bit differently, I presume, to see what works and what doesn't work. So what we said we would do at RVE is develop a reach, engage and retain methodology using something that we've worked with another CEE, the Centre for Energy Equality, to devise an app, the Fairer Warmth app, as our main advice tool. So I will just go on to the next slide. Feel free to stop me if you've got any questions, or just ask them at the end, whichever's easiest for you. So what we've done is the energy advice team at RVE have worked very closely with the software design team at CEE to work on co-creating the Fairer Warmth app. And it can be used on a mobile, it can be used on a desktop, it can be used on a tablet, and it has 3 platforms. I mean, I'm sure someone from CEE would be quite happy to come back and do a demonstration of the app for you, because I'm just really touching very quickly on what it's able to do in this presentation. So there are 3 platforms on the app. There's the public-facing platform, which obviously members of the public can access, and they sign up. It asks for very basic details. If the property has an EPC, all well and good, that gives us lots of information about that house. If it doesn't, it makes a guess from the EPC ratings of the surrounding properties. We ask for very basic income details, energy supplier, tenure of the house. And from that, it creates an action plan for people and directs them, as you can see on the side of the slide here, to what grants may be available for them, what financial support they may be able to get to undertake some retrofit measures. Very, very few people who we deal with are in the able to pay sector. We're dealing with people who are in harder to reach communities. They're quite vulnerable, and they're in, well, not all, but the majority of them are in stone terraced houses, which are, we class as hard to treat. So that's the sort of demographic of people who we're working with. So the initial idea was that we would reach people by them downloading the app from the QR code. They would then have the option to request further support from an energy champion through the app. That is one of our learnings, which I will come on to in a little bit. So it identifies any grant eligibility for them. It also gives lots of tips and hints on how they can make the homes warmer through quite simple measures, draft exclusion, radiator valves, that kind of thing. The second part of the app is for the energy champions. And this, as I say, we've worked hard on developing this over the last 12 months. It's a very different piece of kit to what it was initially. So we've now we built into the app a case management system, basically. So what happens is someone comes onto the app, I can allocate them to a champion, that goes onto their case list. Within that platform, they're able to set themselves dated tasks. They can follow an action plan with somebody to see what progress is being made. They can upload documents, photographs, EPC certificates, any consents that may be needed. And they can manage their own caseload in that way. We can add private notes, which only members of the team are able to see, and we can add public notes, which are shared with the householder. So that's it's now quite a sophisticated piece of kit in that part. And then there's a whole admin part, which is really good from my point of view, because for data, all the data that we're collecting is aligned with KPIs for the lead project. So when I come to do the monitoring report for DESNZ, I'm basically very much exporting data from there onto the DESNZ reporting spreadsheet. So that makes my life much simpler, to be honest. But there's also lots of other things on there, like, for example, we can target people to send out notifications. Like, for example, recently we were doing getting ready for winter workshops. So, for example, if one was in an OL13, one of the workshops was held in an OL13 postcode area. So I was able to target everyone on the app who had an OL13 postcode, send them out information about the upcoming workshop. We can set up, another example is what we call campaigns, and one of the successful campaigns that we do is the GP text message, which I'll tell you about in a little while. It sends out a link, and from that we know how many people have hit onto that link on the app. So it's useful. It's really useful tool for data collection. It's as I say, a much more sophisticated thing than it was when we first started, because some of us have worked on big case management systems previously in other jobs, so we brought our experience from that to this, and the software team at CEE have been able to incorporate it, and we make changes, and they go out and test them within the community and come back and say, yes, that's worked, no, that's not working, we'll need to rethink that. So, as I say, we've been developing that over the last 12 months. And up to date, we've had over 300 properties added, and advice has been given to 270 people through the app. So that's our main innovation tool at RBE for delivering the lead projects. I do believe all the lead projects are now using the app, but we were the sort of forerunners for it. So, but what we did realise in our learnings was that the initial idea was that we'd get lots of flyers out into the community, lots of social media posts with a QR code that people could scan, download the app, and then, as I say, ask to have support from an energy champion if they needed it. That didn't work, needless to say. So what we do now is we do lots of advice pop-ups, we go to lots of events, we do lots of workshops. So we support people to apply for any grants that they might be eligible for. One member of the team is also trained to do energy assessments, and he's also just finished training on retrofit assessment. So he can go around and do a full energy assessment of someone's home for them. If they need an EPC doing, he can provide that for free for them. So that's been really successful for us in getting people to engage with us. One of the things that we realised quite early on was that we wanted to develop this link of a healthier, warmer home by working with the NHS. So one of the things that we came up with, what we realised was that if you want to work with the NHS, you've got to come up with something that will A, be a benefit to their patients, B, won't take them very much time, and C, is cheap to do. It's not got a big financial burden attached to it. So what we've come up with in the Rossendale area, there aren't many GP practices. They're all quite big centralised practices. So 3 of the main ones agreed to send out a text message for us. So what we do is we send out a text message, and we're targeting patients with respiratory, cardiovascular or immunosuppressed conditions. So all those patients that they have get a text message from us with a link to the app. And then if they put themselves onto the app, we can follow up with them and do all the advice. So that has been pretty successful for us. I think we've had 220 hits so far on the app, and that's still ongoing. We ask them to spread to do it on a rotational basis, whereby they send out 50 each Monday morning, one health centre at a time. Otherwise, we wouldn't be able to cope with the demand. So that's how that works. And basically, we're offering a pretty holistic service as well. We do work closely with Citizens Advice. So if they've got an energy team there, but if we come across people with energy debt, we can refer them to them. If they need a fuel voucher or a food bank voucher, we can refer them to them. We're working closely with an organisation in our area called HomeWise, who are delivering something called affordable warmth. So there's a lot of partnership working going on with us as well. So that's basically how we're delivering. We've become, when we initially started, it was very difficult because RBA at that time was quite a new organisation and we were a brand new project. So it was building up our profile within the community, building up trust within the community, because I'm sure I don't need to tell you, there's an awful lot of cowboys and scammers out there doing stuff that, you know, it's putting people off. We've also had some very high profile cases in our area of retrofit schemes that have gone badly wrong, where lots of people have ended up with very seriously mouldy properties and that have ended up in the court. So those are all sort of hurdles that we've had to try and overcome in building up relationships and trust with people. So what have we learned so far? We've learned an awful lot really, but I've had to obviously condense it for this. So what we learned was, as I said, people trust people. They don't necessarily, the digital only approach didn't work. So what we've had to do is, as I said, build up those community relationships, get people to trust us. People like face-to-face advice. I know it's not particularly innovative, and I know it's more time consuming and probably more costly, but that is, you know, in the end it is cost effective because that's how we're managing to engage and retain people, by going out and talking to them. So our advisors will go out to, we have pop-ups in all the libraries and in GP surgeries, and we go to lots of different events throughout Rosendale. They will have the app with them. They will give people advice. They'll talk to them. If with their permission, they'll enter their details onto the app, and then we can start off the whole advice process with them. As I said, the links to the GP texting service has been one of our most successful things that we've implemented. It's cheap, it's easy, people like it. I think one of the reasons it's been successful is, on the whole, people tend to trust their GP. So, you know, they know it's not a scam text from somewhere. If they're getting a text that's coming through the GP service, they know it's something that can be trusted. So what we've also found is that, you know, as I say, very few of the people who we see are able to pay. Most of the work that we do is grant focused, and it's just such a confusing landscape for people to navigate. It's, you know, it's a minefield, and, you know, people think that they're eligible for something, then they go a bit further and find that they're not. And when they are eligible, they have lots of difficulty sometimes getting all the necessary documentation and paperwork together, finding a supplier who can, an installer who can do the work for them. All those sorts of things are really off-putting for people. We find that it's sometimes excluding people who are in need because of some of the strict eligibility criteria for the grants, and we feel that there's an over-reliance quite often on the EPC rating. Someone can have an EPC of C who doesn't have a functioning boiler, and things like that. Lots and lots of misinformation out there. I think that people need education on retrofit. They need just what it is and what the benefits of it are. You know, people are saying to us constantly, "Oh, I can't apply for anything. I'm not on benefits," and things like that. So there needs to be some sort of campaign, I think, to give people good, sound, basic information about the retrofit and what the benefits can be for them. So I think there's definitely a need for some policy change. We definitely we would love, I know it's a big ask, for the Department of Energy Security and the Department of Health and Social Care to start talking to each other. Because, you know, everyone is registered with a GP, more or less. Just in our area, there are over 74,000 people registered with the GP. So we really feel that they're missing a trick there, that, you know, to sort of not exploit that somehow. So the motivations and barriers, the biggest motivation by far for people in our area to undertake any sort of retrofit measure is reducing energy bills. That's by far the biggest one, closely followed by improving health and then improving the comfort of the home. what we find is, in terms of barriers, people are very happy to undertake the smaller retrofit measures, you know, the LED light bulbs, the radiator reflectors, the draft excluders. They're not yet ready to take that step into having more work done. And I think that's partly because they're just not interested. It's not a priority for them. They don't seem to see that this is they're not fully, we do try to make them aware of the benefits, obviously, but they're not fully aware of the benefits. It's not a priority. Like I say, we're dealing with people who are very often in vulnerable situations with very complex lives. You know, they're more concerned about what they're going to feed the kids for the tea tonight rather than should they get in more internal or external wall insulation. So those who do show an interest are very concerned about the disruption it can cause for them. That's particularly the case with older people, we're finding. And again, that lack of reliable information. Lots and lots of misinformation going on out there. So yeah, we've learned lots, as I say. I think for us, it's definitely been the development of that relationship with the NHS and working, going down the healthier, warmer homes route to an extent where we've now made, what we found was, because they're busy, we can go and meet with, say, for example, health visitors, tell them all about the project, how they can refer people into us. They'll say, oh yeah, that's great, and then they forget about us. So you have to keep constantly reminding people that we're there and what we're doing and everything. So we've just very recently made one of our team a dedicated NHS advisor who will be going out, she'll be showing them using NHS and government data the benefits that this can be for their patients. Hopefully how to use the app so they can just put very basic details on there and we can do the rest. And, you know, just dealing with any referrals that come in that way. I really do feel that we've got to keep pushing this work with the NHS. So basically that's where we are. I feel as if we've only actually been delivering the project fully since January this year. There were various delays and we were late starting, and by the time we recruited a team and everything, we had the full team on board since January. I feel that we've done an awful lot in that time. I feel there's an awful lot more we could do, but obviously we're coming to that cliff edge in March now, which I feel as if we're just getting going, really. We're just getting started. Because what we've you know, it is, you know, test and learn, and we've tried things and thought that doesn't work, what else can we try? And it's been very much a continuous learning process for us. So I don't know if anyone's got any questions for me. I'll try and answer for you.
Thanks very much, Jenny. That was great. People are clapping with emoji reactions, so that's good.
I can't see all that. You've disappeared on me. You're just down the side of my screen. Thank you.
We've only got 24 minutes left, and we still want to hear from Justin.
Oh, sorry, did I go?
That's okay. I don't know if you did or not, but you know, Duncan had his bit, and people didn't arrive for a while, and we are where we are. Justin, are you ready to go next? Do you want to end your share, please, Jenny?
Oh, sorry. Yes, of course. Do you want me to share these slides with you, Duncan? Then, sorry, Joseph. Then you can.
Yes, please. Yeah, then I can circulate them to the group as well.
Yeah.
Yeah. Thanks very much.
I have no slides. I just have my voice. But
that's fine.
Yeah, that's all right.
That's fine. Thank you very much.
So I'm going to do a quick update on the consortium we've got in Devon and Cornwall. So we've got a consortium made up of Plymouth Energy Community, Exeter Community Energy, 361 Energy in the north of Devon, Tamar Energy Community in the west of Devon, and South Dartmoor Community Energy in the south of Devon, and Community Energy Plus in Cornwall. Can't remember if I said them yet. It's too many consortium partners for my tired brain to cope with. So we've got them as active consortium partners and the local authorities in the area as kind of formal partners engaged in what we're doing, but not so active in the scheme. We have taken an approach to the LEAD project to try to build a kind of funnel of advice to get people to take action. So not just a single service, but to try and look at various different services to get people to take action. And within that, to trial approaches that are more conversational than technical, to see how that works. And the reason we went through that in the consortium approach, it would have been very possible for PEC several other partners to bid in and to got funding individually to do what they wanted to do. But the reason we wanted to take a consortium approach is a few reasons, really. One is, I think the real value in community energy is the hyperlocal, and it's really understanding your area, and it's really understanding the homes, and really having a reputation in your local area, and that is hyperlocal. But we also understand that for funders, working with lots and lots of hyperlocal organisations is an absolute pain, and it's never going to be attractive for the kind of funding that we might need. So we need some models that allow us to have a single link to funders that's then that then delivers lots of hyperlocal work through different community energy organisations. We really wanted to work on that model. Within that, there's a barrier, I think, also in community energy, that there's just a limited capacity for project management and for developing new things. And if we're trying to develop a whole funnel of work across, in any one of us as organisations, developing a whole funnel of services in a new area, we were going to struggle with capacity. So can we address that capacity issue if we work together and use the bits of capacity we all have collectively to do that? So that's the second reason. And I guess when we're setting up, we wanted to kind of learn from partnerships that we don't think have worked quite so well. There's often the role I talked about, where funding's given to one organisation and then they work with lots of hyperlocal organisations. That exists in other areas. There's many people here who might be, experienced it delivering LEAP, for example, as an example of this. That model can not work brilliantly sometimes. It can work great sometimes, but not work brilliantly for some community energy organisations where just all the power exists with one person who's got the relationship with a funder, and everyone else is sort of dancing to their tune all the time. And there are other partnerships where failure of one person within that partnership leads to problems for all members of that partnership, and those kind of things bring tensions into consortiums that we really didn't want to build into this consortium. So we wanted to have the value of lots of hyperlocal organisations all working in their own area, joining together, combining some of their kind of project management and development resource to do something bigger than we could individually do ourselves, ideally, and kind of show that model kind of works and can allow for flexibility within those different organisations, that some will do really well at some things and some will do less well, and we don't all carry a kind of collective financial risk for that. So what we've done, we've kind of set up the project. We've got 1.4 million pounds worth of funding to set up kind of quite a big service across Devon and Cornwall. We've really set that up into 6 individual projects. So each community organisation has kind of got their own set of KPIs to deliver, their own budget assigned for that. If they deliver it, they get the money. If they don't, they don't. It's quite simple. In that way, as a person organising it, it sort of doesn't matter to me if somebody doesn't deliver their bit. We could probably soak up any extra in the rest of the consortium. If we can't, then we just return some money, and we don't lose money. It's just the organisation that didn't deliver that does. So there's a kind of really clear accountability framework within that. And then we've also got 7 working groups that are, so we just start delivering the services from as early as possible, and 7 working groups trying to work through how we do things better and bolt that on as we go along to all of our services that we're delivering. And that's the idea. So the aim is that at the end of this program, we'll have a really good service in March, but not necessarily that we started with a really good service in January. It's a learning as we go approach to a project. So I mentioned a kind of advice delivery funnel. What we're aiming to deliver there is over 10,000 people spoken to at events in the community, all sorts of things from energy fairs to going and having drop-in surgeries at employers who kind of publicise your presence there, to talks to local communities, whatever, all the sort of things we're fairly familiar with doing between us. But yeah, lots and lots of different ways of engaging. Open homes events we quite wanted to do in there. Hopefully we might get a chance to do some of that. So 10,000 people kind of engaged about retrofit and talked to about retrofit literacy and that sort of stuff. Over 1,000 people to receive home visits, and this is not a technical assessment of their home. This is a really well trained and knowledgeable and personable advisor going into somebody's home and saying and asking them questions, getting them talking about what they were thinking about, getting them talking about what plan they've got planned for their home, and basically trying to mold that plan with them into something that makes a bit more sense. It kind of works for that person, give them the information to give them confidence to move forwards, and certain aspects of that plan, and have a conversation, have an hour's conversation with somebody in their home that leads them more confident to progress with retrofit. As well as that, 400 whole house plans. So that is a more technical report that gets sent out to them, and then some kind of target and some resource for follow-up retrofit coordinator support for the more deeper retrofits in there. So that's the kind of funnel, and that's what each organisation is trying to deliver in their own area. The figures are given obviously a collective across the project. The building as we go along, that's included some market research and some kind of shared resources. So we've got some whole load of illustrations that we can all use in our marketing that have kind of built off that market research to say, like, who's our audience, how should we be communicating to them, and some case studies and some other, flyers and so some really good materials to engage people in a variety of different ways, as well as that knowledge of actually who are the audience. There's some interesting stuff in there, particularly around like how important and how valuable a resource millennial homeowners basically are, actually how motivated in many ways they are to act on retrofit. Probably not at a kind of deep retrofit level, but I mean, if you can catch them now and get them doing some of this work, they will at some point inherit quite a lot of money and maybe want to move on to deep retrofit. So yeah, there's kind of market research and shared resources, code of practice. So to really nail down what's the training that somebody needs, what's the quality assurance approach, what's it, all sorts of different things into a code of practice. A kind of collective trove of advice resources. We're not necessarily creating those ourselves. We're just trying to collate what's really good. A review of whole house plan options. A lot of us hadn't got a kind of, a solution, whether it's the carbon co-op report or some other kind of form of whole house plan option, but there's quite a few available. We just wanted to really sit down and have a fine-tooth comb look at them from a householder perspective. What are you getting from each of these? How complicated do they deliver for us? And what looks like it might be the best option for us to go forwards with. So we've got a kind of report detailing what we've done in that space. And then also we've got a kind of evaluation consultant working alongside us, and a team that's kind of really engaged in doing sort of learning events, but also a whole load of evaluation to build in customer feedback to the way we develop that service as we go along. So that's a project. In terms of the learning, the last thing, I think one thing we've learned is that funnel approach, the idea being that the people that we engage in the community at first go on to have a visit, and then they go on to have a whole house plan, and then they go on to do a deep retrofit. I think we knew that it wasn't going to work exactly like that, but it really hasn't. And the further we get down that funnel, the harder it's been for us to reach our targets. The engagement and the home visits are going very, very well. But the other side of that is it seems like just nice conversations with customers in homes that are kind of technically informed but not technically led seem, and we've yet to see some of the kind of data on this that would confirm this, but it feels anecdotally at the moment and with a bit of data like that's doing a really good job of getting people to act, i.e. we don't need to do necessarily in all cases, and that is at a kind of a lower level. We're not talking about people acting with deep retrofits there, but it is get people investing in their homes with retrofit. And I guess part of our theory here is if you can just get people to start to do that, they see the benefit, they might move on, they might kind of spread the kind of might talk to people about that and encourage more action. Big barrier we found, which is nothing new I think for anyone, trusted installers and a really good system for linking up with trusted installers that we can say to a householder, oh, so you want to do that? Go speak to these people. We suggest these people, we've vetted them, we know the kind of work they do, they should be good. The lack of that is a real trust barrier for the action that happens after we speak to somebody. And then on learning on the consortium model, I think it's been really great for developing the kind of organizations involved in the partnerships. I think particularly some of the smaller community energy organizations are saying that it's really helped them, and it's really helped them to kind of work with other people and gain expertise, borrow expertise from other organizations while kind of offering their expertise in other areas, and really help their kind of understanding and how they're trying to develop these kind of services and build the services in the way that they wouldn't have done otherwise. I'd say not all the working groups have worked brilliantly. Some have really nailed what they're trying to do and have really driven forward what we're trying to do. Some have not kind of engaged quite so well. And I think that's for a complicated question as to why that is. Yeah, so that thing of if we can join together all our capacity at a project management level and then we can get so much more done, I think it's a mixed bag in that space. But it's certainly not worked badly, but some haven't worked as well as others. The other thing is, for that kind of model, I think what we've learned, it's been heavy going at times for PEC, is that that kind of competent, confident project management is very important in this. We've done a lot of pushing back initially, with some quite tense conversations with the funder, and done a lot of structuring and really setting out how this, in quite a detailed way, of how like that consortium process will work, and that's all paid dividends. And you know, has both with the funder and also with the way it's delivered. But it was heavy going, and if I wasn't used to working with government funder like DevSNES, and the need to sometimes say, that's ridiculous, and we need to look at that again in a bit more detail and work out what you're trying to achieve. If we weren't used to that, and we weren't used to kind of working within a consortium framework to deliver projects, I don't think it would be going quite as well as it is. So, and by and large, I should say I've not mostly been the project manager for this. So I say that not in a kind of self-aggrandizing way.
Thanks, Justin. That was really great. I'm definitely going to email you and say, can you share all of the many resources that you've mentioned then, and we'll put them in some shared place where everyone can access. Last but not least, Zana, sorry, I always forget how to say it.
Thank you. I will just hang on a minute, because I will need to share my screen.
That's okay.
I will go to the bottom and press.
Normally in the middle somewhere, there's a, well, for me, it's a green button. That's it. You got it.
Brilliant. Thank you both, Jenny and Justin. Absolutely fantastic to hear about your projects. And I will try and whiz through. I have got slides, but I will have to skip through pretty quickly. So we're based in Southeast London, and we have got CELSI working with Repowering London. So we're two organisations together on this lead project. And the same as other people, we've got DevSNES funding. We're going through the Southeast Hub. We've got partners with local authorities and Community Energy London, and research partner with Sussex University, which is the Energy Demand Research Centre. So I'm going to go through some of the how we've set up, and then some of the learnings. So aims, really, like everyone else in the room, we're about people at the heart of Retrofit, building community resilience as well as lowering carbon emissions. And we're community energy organisations already. So why are we at the heart of Retrofit? As has been mentioned, because we might have trust, we might be visionary in that we've already been working on trying to move forward this just transition and energy transition, and we're embedded in communities to some extent. We'll come on to that, because obviously when you're trying to move forward. So CELSI and Repowering London both have developed skills over 10 years in slightly different areas, but including piloting a Future Fit Streets, piloting a Retrofit Streets project, and working with flats. And what we found is that we really have come from CELSI, particularly a fuel poverty alleviation background as well, working with energy advice and supporting vulnerable people. And also we've done some working with the able to pay and whole house plans. So the learning is building community and creating a replicable model that we can roll out. So that's one of the outcomes that we want to have. The retrofit industry is emerging. So it's all about also training people, getting people into new skills. And we feel that case studies can demonstrate very clearly what the outcomes are, so that people can see what can be done and have confidence to buy in. So we've got a process, which is basically through the PAS 2035 process, whether it's eco-funded or able to pay. And I won't go through all the points on the slide because of time, but we're basically using the same standards and roles, but applying them to both able to pay and eco-funded. So we've got a core team. And in the team, we've got a really good, strong outreach team that includes social media, all these events that people have been talking about. We've got Trustmark registered retrofit coordinators and retrofit assessors, project management, which includes advisors and communications and system setup, and research coordination. And then we've got the partners that we're working with. Outreach events. So as has been mentioned, a lot of this is about having the conversation. So we are present at events. So when we say 16,000 attendees, that is a bit of a big number, but actually that means that, say at a big summer festival, we've had a stand, we've had conversations, people having the awareness of this is an issue to be interested in. From all these events and activities, 450 people have signed up to our actual service over a year period. So this is the funnel effect. Obviously, people start, at one end, people are getting some information, awareness, and then obviously we're going to be going through. So then we go through the stages. We've got the stages from naught, which is client interest, into work on site at 5, handover and feedback. And the numbers, so this is where people are at the moment in our programme. So at the beginning, at stage naught, they're hearing about the service, they're going to workshops, events, knowledge sharing. And at stage 1, they might have an in-person visit, and then or a telephone call, and then retrofit assessment starts at stage 2. If we were going to help a household to get through to actually eco-funded work, that will have to be installed within 6 months. And at the moment we've got some people that have gone all the way through, but the funnel effect definitely happens, is that people don't all go through to install. So just to give a snapshot of the sort of measures that have been installed, roughly 57% through the grant funding, 43% self-funded, and they include loft insulation, boilers, cavity insulation, loft insulation, a variety of different measures have gone through to install. So definitely the funnel effect is happening, where we've got 35 installs so far, as opposed to all the people that show an interest. So what are the learnings? Why place-based? Well, similarly, that's been mentioned, we really think that the community networks are crucial. All the outreach events, but also property archetypes. So like with East Lancashire, there's the stone properties. We've got mostly solid wall properties in our boroughs. We're also working with flats, which have got their own archetypes, but again, different boroughs have a concentration of certain property types. And so we want to really push forward with these case studies of particular property types so people can relate to them. People, we're really supporting those traditionally left behind in this retrofit process. And one of the learnings on that is that with the eco funding that people might be eligible for, the funding is falling short, because often those people, because we're working with homeowners, and this group might often be pensioners who own their own home but can't afford to do repairs, let alone the retrofits. So they might be vulnerable, they might be eligible for grant funding, but there's a shortage of funding for enabling work and making good work, and contractors don't always want to take on complicated cases. The different types of homes, so the properties, we've been looking at hard to treat. As I said, most of the properties are coming in that category, and they need deeper attention. I mean, even in the PAS process, they have to have certain extra reports, and obviously the complexity needs a budget to match that complexity. With the team, why are the skills still new? So with the PAS 25 process, which is trust marked and robust, there's very few practitioners who are very experienced in it. So when we're recruiting, we're finding people who've trained as a retrofit coordinator, they might have passed their exam, but they haven't worked as a retrofit coordinator. So we're still in the process of building up this retrofit industry for domestic retrofit, and contractors who are going into the market through the eco funding, where they're dealing with energy companies, they're finding that the funding fluctuates, and that's very unstable for them, and it's hard for them to have a steady work stream. So building up the capacity of the contractors is also affected by the funding fluctuations. And the other thing on the team is that we feel that a lot of people are able to move into retrofit from the rest of the construction industry. So bringing their construction industry skills and moving into the retrofit sector. So, but we've got people moving from many sectors into retrofit, bringing different skills. So little summary on some of the learnings. The outcomes are really important, and people are reporting to us what their motivations are. 45% are motivated by making the home more comfortable. So they're naming comfort above CO2 reductions, health, or bills, which is really interesting because that's not what we expected. So that is a big focus on retrofit, is not only to reduce carbon, reduce bills, but we're also at the same time tackling some of these building failures, so repairs and damp, mold, condensation. So this is altogether healthy for people's living environment, and creates better living conditions as well as CO2 savings. We've identified the missing middle who are not eligible for any of the grants and don't have their own funds, so we offer them energy efficiency advice. We want to still mention deep retrofit. I know in the PAS process, it's like, don't mention 80% reduction, but we know from previous work that it is a possibility to do 80% reduction and produce homes that don't need any heating services. So we want to still keep that on the agenda, because some able to pay might go for that option. But also when we're talking about government funding, if we keep doing light touch retrofit, those homes will still need deeper retrofit in the future. So the conversation isn't necessarily having on our project very much, but it's there as a backdrop. So we've trialed eco. The 80% reduction was through the Technology Strategy Board scheme, and that was allocating 150,000 per property, which we haven't got. So the eco scheme is allocating more like 15,000 per property, very different scale of work. But we're also trialing with the able to pay a point of intervention architect advice, so that if people say, oh, well, not sure about retrofit because I'm thinking of doing my kitchen extension or my loft conversion. So we go, yes, okay, this is what you can do at that point. Let's build on people's home improvement plans and bring in retrofit at those stages. So in our budget, we've got some of our properties and householders who are going through this route, getting architect's advice as well. And it's up to them whether they employ an architect to carry on. And we want to plan, as well as helping people with lowering their CO2 emissions and fuel bills, to look for the easy wins. So the easier to treat properties, not just the hard to treat properties, that means. And alongside giving energy advice and behavioural change, because what we found with our energy efficiency work with the fuel poor is we can reduce carbon emissions a lot with boiler controls, thermostats, advice on moving to different energy suppliers. So there's a lot that can be done without the physical retrofit, and we want to build that into the model. And to build in how to use those motivating factors. And this is just an overview of some of the different methods which I've already mentioned. So I think this is kind of just summarizing what I've said. We've gone over time, so I think that will be, I will go to the last slides at just showing some of our events, and basically we're asking people to get involved, and that's, you know, I think that's half of it, is just, as other people have described, the conversation seems to be vital, you know, vital part of it, and really exciting that people are interested in retrofit and going to the events that we're holding.
Great. Many thanks for that. That was wonderful. Yeah, sorry everyone that we've gone over slightly, but I'm personally...
Sorry, I had to whiz through.
Yeah, I mean, it's such is life. I'm personally able to stay on a few more minutes if anyone else can and has got any quick questions for Jenny, Justin, or Zaina. I couldn't help notice the difference in the motivations. You know, up in Rosendale, it was very, very much about bills, and much less so seemingly in Southeast London.
And I think we'll have to do some more research into that, because these are these are motivations that people have self expressed on a sign up form. We're going to be doing much more in-depth conversations with people, and I think every time you see numbers, I mean, Desnes initially asked for numbers, but then they moved on to some more qualitative data, and I think that will be really interesting to get those conversations. Yeah, because as I say, a lot of our clients come from looking for help with their bills and energy advice. So we know that is of interest, and maybe that's a given. So then they want to explain the other motivating factors. So yeah, good question.
I thought it was quite interesting on the Desnes reporting that within those motivations, there was no option for carbon reduction as a motivator. Right. It just comes under other, doesn't it? It's not mentioned anywhere.
I think we added that into our reporting.
Yeah, we have. Yeah, yes, but that's the main thing that comes out with us when we're having conversations with people, that they want to reduce their energy bills. They don't necessarily want everything that's involved in it. Like I said, the lighter retrofit things, and like you were saying, Zaina, you know, radiator valves, all those sorts of things. But it's much harder to get them to take up the deep retrofit up here anyway.
Well, I like that the sort of intervention when people are going to do stuff anyway. In years and years ago, when I used to live in Highgate in North London, Highgate Society, or a local little community group, they developed these little packs for the local estate agents, which was they handed out whenever someone bought a property, saying, and it wasn't focused on the language about it. It wasn't about energy or carbon. It was about, I mean, Highgate is an obscenely wealthy area. It was about, you deserve a 21st century home. And this is how you go about creating a 21st century home. And lo and behold, it ends up being a low carbon, low energy home as well. But it was more focused on that sort of comfort and desirability of it all, more than the other scale of it. I mean, that was partly focused on, you know, the demographics you get in wealthy North London.
Thanks for mentioning that, because we have discussed that. So who can give that kind of advice? So we know we can't change the building regs or the planning overnight, because that's a lengthy process. But asking the planners and the building control to give advice sheets like that, and asking the estate agents to give advice sheets, that is definitely something we've been talking about. We haven't done it yet, but exactly what you've said, because that is the point when people are buying a home, that they might be spending money even before they move in, and they can do some of the measures that are harder to do once you've moved in.
Yeah.
And if you catch it early enough, when they're planning, oh, what are we going to do? These people with money, as you mentioned, then that is a brilliant point. Yeah.
And I'm really mindful of the overlap with all the health stuff that you mentioned, Jenny, and how successful that's been. And I think, is Harry still here from Exeter? Yeah, I think Tara mentioned before that Exeter have also been doing lots of targeted work with the GPs around, you know, mapping where there's food poverty and where there's respiratory issues, and then targeting support there.
Yeah.
It seems to be a fruitful seam to mine or something. Searching for my metaphors.
Can I ask Justin a question on the whole house plan? Which one did you end up going with? You said you did your research.
Yeah, there was. Yeah, it is an interesting one. So there was two that in terms of quality and what they offered to householder, that were pretty neck and neck, and that was People Powered Retrofit, my home retrofit planner, and there's a company based down here, retrofit services company called Dartmoor Energy, who have built off the MCS methodology and the kind of calculations around that, and built a kind of whole house plan report that they produce based off that, which is similar price, similar kind of time taken, different methodology for calculations. But again, in terms of the quality, was more heat pump led. But yeah, those both came through in terms of quality as the best. Interestingly, there's also an entirely volunteer-led community energy organisation, Teen Energy Communities, based in South Devon. Some of you may know Fuad. They've produced one with a kind of local architect that they do largely for free for households that want it, and they're like, they do hardly any. That was really close. Actually, the quality of thought that had gone into that, just as a group of very technically able volunteers, it looked, it was kind of very close in terms of the kind of scoring and the analysis of it. In reality, we've actually found all of them quite difficult to shift at, 800 to £1,000 per report. That's not the market. And so we're all now developing on we're developing something with the Parity kind of software for Surveyor Pro software, that's a bit more bespoke, but something that which we'll try to do, essentially a retrofit assessment, and off the back of that, suggest some measures coming in at about £300 to £350 price point initially. But actually, to reach our, we initially weren't subsidising whole house plans at all. We're hopefully going to do a few bits of budget adjustment and start to subsidise them as well. Because yeah, I mean, certainly,
I can't help wondering if all those billions for carbon capture and nuclear and stuff could fund a proper survey of every building in the country, because that's, to me, that seems to be what obviously needs to happen. And all this, people call them different names, don't they? Digital logbooks, building passports. But in my view, every building needs a proper one of them. Let's do a cheese door blower thing on every building. Let's do the proper heat retrofit, like the heat geeks come in and do their actual heat measure loss of every room and all that sort of stuff. I mean, that's...
Yeah, the classic response that we get from our customers is, now I know where to start. And as has been said by many people, they like to start with the low cost things. But if you have the thermal survey indoors with the pressure reduction, you can target it. And that means you get very good value for money for these DIY style interventions, which probably only cost £100 anyway. And you get improved warmth, you get improved comfort, you get a healthier environment, and so on and so on. And it also gets them started on the pathway of retrofit, because they recognize that it works. And then as and when they have more money, they can do the bigger ticket items. That's the classic journey that our customers go on. I'm delighted to say we did 278 surveys last winter, and hope to do that many or more this winter.
Great stuff. Well, we've run over quite a bit already. Has anyone got any final thoughts or questions or anything before I end it?
Well, thank you all. Very interesting.
Yes, big thank you to everyone. Extremely detailed and fantastic stuff.
Yeah, thanks so much for Jenny, Justin, and Zaina for sharing your learnings. Yeah, send us your slides, and Justin, I'll email you about all the goodies that we're hoping to get from you. Well, thank you so much, everyone. See you in a month if you're regulars to these.
Thank you very much.
Thank you. Bye-bye.
Have a good rest of your day.
Thanks all. Bye-bye.
Bye.